Hello, good afternoon. Yeah, and I thought wala pa. Okay, so this afternoon, it's going to be an exciting afternoon. Again, we will be discussing about rabies because this March is a Rabies Awareness Month. So Dr. Gills will be the one discussing this topic. Okay, Dr. Gills?
Good afternoon, everyone. Today we will be discussing rabies. Uh, what is it and how can I prevent it? Huh? It's a very timely topic, like Doc Ivy mentioned, that um, it's Rabies Awareness Month. So we want to improve awareness of rabies. Now, I'm sure everybody is familiar with anti rabies vaccines, and we will be discussing a little bit more. We have a special guest towards the end of the discussion, right, Doc Ivy?
Yes, not only that, Dr. Gills, our guest this afternoon has prepared a lot of prizes that you can win if you participate live in this show.
Oh, very exciting. So, rabies, what is it? It's a virus. We're very familiar with viruses right now due to a certain virus that we all know. This is a different kind of virus because it's transmitted via saliva of infected animals, not in blood, not in urine, but in fact, saliva. No, infected saliva. Now, um, not necessarily during a bite. No, if you have an open wound and you get licked by a dog with rabies, or a dog that licks its paws and then scratches you, you can get this. The current animal that transmits rabies in the Philippines is the stray dog. Right, Doc Ivy?
Yes, they're the most common ones here in our country.
Now, unfortunately, the most reliable way to diagnose rabies is through brain tissue. And the only way you can get brain tissue is uh, post mortem, meaning to say after the animal is dead. There are certain test kits that are available, but unfortunately, the reliability is not as effective or as reliable as brain tissue. It is a big problem in Asia, Africa, and South America. So it's very, very common wherein these continents have a lot of rabies. So it affects the brain and spinal cord. It's very nasty in the sense that it paralyzes you. So, what's one of the most common uh, symptoms that we hear about Doc Ivy?
All the most common are one, where the person that's affected and the animal that's affected with rabies is they're afraid of the light, afraid of water, because they cannot control their nerves. Okay.
Yes, they actually can't swallow, and that's why they're afraid of water. So that's why they have a hard time drinking the water. Unfortunately, rabies is fatal once symptoms appear. So it's very important to prevent this disease. Once you start showing signs or your pet starts showing signs, there's little to no chance of survival. Any mammal can get rabies. Mammal. Animals with rabies can act differently. Now, I'm just uh, exaggerating this a little bit with humans that act funny, but there are two forms of rabies. One is the furious form, which everybody is aware of, which is wherein they bite, they start attacking things that they shouldn't bite. And the other form is what, Doc Ivy?
Go ahead, Doc Gills.
The dumb form, wherein the dog is very weak and does not move around and he cannot really move around. It's very weak. So there are two types. One wherein the dog is a typical case of rabies, where he's biting at the cage, biting at people, biting at other animals, and the other one is where he's not moving at all.
Dr. Gills, those are the two typical signs, but then there are also some that do not manifest any of those signs until they're already in the further stage of the disease.
Very true. What I was saying, yes, thank you for clarifying that, Doc Ivy. It's two types of rabies. The symptoms of rabies are, like Doc Ivy says, sometimes it takes a very long time before symptoms come out. Average is about 2 weeks, but it can be as long as 2 to 3 months, sometimes as long as 6. So you want to be very careful. So how can we prevent rabies? Anybody guess what's the number one? Number one is vaccinate your pets. It is Rabies is completely preventable, 100% preventable through vaccination. No, there is no reason to not vaccinate your pets against rabies. Uh, the rabies vaccine is one of the safest vaccines you can give, and it is very, very mild compared to vaccines. Now, with new guidelines set out by the World Small Animal Veterinary Association, vaccines, rabies vaccines specifically, are given at 3 months of age and then at 4 months of age. Especially in our country, wherein we have a high occurrence of uh, rabies, it is very important to maximize the protection your pets get. And that is why we've been implementing 2 shots of rabies, one at 3 months and one at 4 months. The other thing is keep your pets confined. Now, confined does not mean caged. Your pets need the walk, they need the exercise, they need to move around. But it means that you have them under control. You don't let them run free, you don't let them go say hi to the females around the corner, wherein there's another male and they end up fighting, and that male dog had rabies. So you want to keep them under control. Yes, some people do walk their cats, although you have to be a little bit more careful. This is a very important thing to prevent rabies. The other thing is for humans, do not approach unfamiliar dogs and cats. Cats can be carriers, although it's less common, but they can be carriers. They carry other diseases with their bites and scratches, but that is a topic for another time. This is a very important thing that you want to be aware of. Some people are not aware, especially if they come from countries wherein there is no rabies. You have to be extra careful and do not approach the dog, especially in their territory, which they can be extra aggressive. This is an interesting one, which makes a lot of sense, wherein you have to have your cats and dogs spayed and castrated so that they stay home. And if they don't go looking for mates outside, they're less likely to get into fights and get bitten and get other infections as well as rabies. Discourage any contact from your pet from stray animals. So even if they do go out on walks and you have them under control, it's also very important to prevent them from coming into contact through the fence. We have a funny story that's a little bit wherein a dog got pregnant through the fence of of the owner with another stray dog. So this is a different kind of contact, but you also want to prevent them from coming into contact with stray dogs through the fence, through the gate, under the gate, or over the gate. I know Dr. Ivy had a couple of dogs that actually learned to climb over the gate, correct?
Yes, that's very right. We used to have a pet that knows how to climb, but our fence then was around 8 feet high. Ang galing. It can go up, tas bumababa. Ang galing. And then it goes home, akyat pa rin, tas baba. And another patient of mine before, ang cute, would go from house to house by climbing the walls of the neighborhood. So Yun yung gano'n kagaling ang mga aso 'no, their nose is very good.
Very good. I refuse to believe it when Doc Ivy first told me about this, but I actually saw the dog climb up the fence, and this dog was not very thin at that time, so he was a little bit chunky, and he still was able to climb the fence. So it was. I wish we had a video of that. It would be an interesting thing to show.
Puwedeng akyat bahay gang.
Here's one thing that's very important that I think needs to be stressed more. Now, this is from studies in Africa, wherein they do not have access to um, m- prophylactic and after exposure uh, shots as readily as we do. So sometimes it's 4 or 5 hours away. And they found out that if you wash your hands continuously under running water with a good antibacterial soap, it minimizes the chance. It does not mean you should not go to a doctor. Please don't go to your veterinarian. Please go to a human doctor. We always get messages, I got bitten. Unfortunately, if you do not wag your tail and bark or meow or oink oink or any of that, we cannot treat you. We do not treat humans. Okay, please go to your human doctor and consult with them. They will be more than happy to give you advice when it comes to what to do. There are guidelines that are issued by both the World Health Organization and the DOH that we need to follow. Okay, but going back, you do have to wash your hands very, very well. So uh, wash the area, not your hands. I should clarify. Most of the bites are on the hands, and that's why it's wash your hands. But it depends on where the area is. So where you were bitten, you have to wash it for 15 minutes. No, uh, with a good antibacterial soap and under running water. So you want to wash out as much of the debris, the saliva, etc., out of the wound. It can be difficult.
Dr.
Yes.
Gills. Yes, this one, if your bite is very near the spine or the head, please go immediately to the nearest animal bite center and then explain to them that you got bitten near your central nervous system, because if ang nakapaak, no, or the one that bit you is positive for rabies, then very delicado. The transmission is really fast. Okay. So here in the Philippines, you go to Animal Bite Center. Meron sila available na vaccines against rabies. Or if you want na free, you can always go to your barangay and then they can refer you kung asa ang free na vaccine. Okay?
Yes. Thank you for that, Doc Ivy. The point is, go wash the area where you were bitten, and then go see a doctor. Do not put garlic on it or silver on it or any of those.
Suka,
Vinegar, yes,
adobo na.
yes. So uh, with garlic, vinegar, and a little sile, you can have adobo like like Doc Ivy says. Please do not do that. As painful as that will be, go see a human doctor, and the injections have come a long way. They're no longer 30 injections. They're a series of injections, but they're still very important.
Oh yeah, Dr. Gills, before the rabies shots would be given directly to where your bite was, no? But now, no more. It's given intramuscularly or intradermal, and it's not as painful again, like what Dr. Gills said before, baka 30, 15 shots. But now, I think 3 shots na scheduled are given, no? As post exposure.
So we have a comment. I'm not familiar. What is tandok? Are you familiar with tandok? Okay.
I'm not sure, Dr. Indegarite, what tandok is.
Well, hopefully we'll clarify that in a while. But yes, any of the go see a doctor, please, as well. This is a very serious disease that needs attention. No, not to say that all dogs have rabies. That is a fallacy. Uh, but if it's a stray dog and you cannot trace its vaccination history and its um, current status, then you want to err on the side of caution, being extra careful. Like Doc Ivy said, the closer it is to your brain, the faster you have to go see a doctor. Okay?
A human doctor.
Yes, human doctor.
Unless if your dog is bitten by another animal, then that's when you bring it to a veterinarian.
So what happens if my dog is bitten? Now there are several factors to consider when this is the case. Dog bites in general are very nasty. They can appear very small. They have a small hole on top, but underneath it can have a huge uh, damage. No, a huge damage to the tissue, huge damage to the underlying muscles, underlying. Um, so not only is the chance of rabies a consideration, but the damage to your dog. Now, depending on what the severity is of the bite and what animal, what kind of dog did the biting, your veterinarian may need to repair, may need to give a booster of rabies. Most of the time, it's very important to give antitetanus because the dog's mouth is one of the dirtiest. If you've been watching our dental discussion, we all saw how nasty their teeth can be, and this is something very important. And the best thing to do would be to talk to your veterinarian. It's very, very important because dog bites can be very, very damaging.
Yeah. The damaging one that we saw, if I'm not mistaken, for the abdominal part, ang kidney was removed, from its normal location. Another one was that muralag, parang ang liit ng bite, from the leg. And then when we checked it, it went all the way to the bone, considering that that patient was a dachshund, meaning ang chunky ng legs. So animal bites can be really nasty. Para siyang hook when you go fishing. Maliit ang bite, but then it starts to hook everything, no? And then it can actually bring out a lot of these organs. And then sometimes if the skin is so good, walang problema, the muscles can be damaged, but it's covered below the skin. So it's really best for you to bring your pet to the nearest veterinarian. And please do not forget that veterinarians, the small animal practitioners, are not only in private clinics. There's also your city veterinarian, provincial vet, no? Like we have some viewers right now, Dr. Garit, and also we have from Zamboanga City. Hopefully, you know where to go. Do not hesitate. Maraming veterinarian in the country.
Okay, we have a couple of questions that are interesting. Is it true puppies are more dangerous when one is bitten than adult dogs? No. Um, like I said, puppies do not have rabies naturally. No, they have to be bitten by another dog with rabies. So puppies, if the reason why the misconception of puppies being more dangerous is because puppies have the tendency to explore with their mouth more than adult dogs. So they do not have hands and they like to bite. Now, unless your puppy is an outside puppy that has been bitten by a stray dog in the last couple of days and then is exhibiting weird signs, then it can be more dangerous because they like to bite and bite and bite and explore. If your puppy has been indoors the entire time, has not seen any other dogs, and the mother is vaccinated, then there is little to no chance that your puppy has rabies. Adult dogs will be more dangerous because their bite is more sure and is more um, damaging, like we discussed. I hope that answers your question. Did you have anything to add,
Yeah,
Doctor?
Dr. Gills, others naman, that's why it's very important that the mother dog is vaccinated before it gets pregnant because they actually pass that maternal antibody, no? In short, they are already immune because their body knows na what rabies is. If they are vaccinated against rabies and they give birth, they pass that to their pups. But if the mom is not vaccinated, then most probably the puppies also do not have that maternal antibodies, and hence why you need to be afraid of puppies na you're not sure if they are vaccinated or at least with maternal antibody. Okay? So very, very important to know if the mom has vaccines as well. Okay? But
Yes.
that maternal antibody goes down. That's why we need to vaccinate puppies at a certain age. Okay.
Right. One more question. What happens to a vaccinated dog bitten by a rabid dog? Another very interesting question. Um, so the vaccine is very important in order to maximize the protection of your dog. It does not mean that your dog cannot get rabies, but it's very, very unlikely. It is unlikely to get rabies, and it's unlikely to transmit rabies. So, if that's the case, and what the current guidelines are that your dog has to have at least 2 shots of rabies. So it has to have the first shot and then a booster shot. If your dog has at least one booster shot, then it's considered safe, but still needs to be under observation.
I have a follow up with that, Dr. Gills.
Yes.
When your pet is vaccinated, just like us, we need to have ourselves apparently healthy before we get a vaccination. Because if we are not apparently healthy before any shot, regardless of how good that vaccine is, we will not mount an immune response. Meaning, it will just pass through our body. We had one case, Dr. Gills, remember that dog? Okay, ang dog. And then the last vaccine it had was 2 years ago. And then the record said kasi in the pet's record was 3 years after pan shot. But that dog went out of the house and then came home with a lot of dog bite. After a week, that dog was exhibiting air biting, cannot recognize the owner, salivating, no control. So, few days after it was presented to us, natakot kami kasi parang walang bakuna last year and we know that Philippines is very positive for rabies. We don't know kung sino yung kumagat. They have no history. Nakita nilang bugbog yung aso. So, few days after, like 3 days after that dog died, so we asked the owner to have the head examined because if not, delicado. That dog apparently bit some family members, and again, there's no treatment for rabies. Okay, so just to be sure, let's just follow the once a year since our country is still positive.
Yes, we'll be discussing that as well. Yes, it's required every year to have your dog vaccinated against rabies. Like I said, it's one of the safer eh, excuse me, vaccines that's available. And there's no reason there's a government mandate wherein the government goes depending on the LGU from areas that need vaccinating. No, so it's very important. We also have the clarification from the Tandok. Uh,
Let's read that tandok.
yes,
Tandok is the removal of venom, rabies, and tetanus from a bite using animal horn, and tawak, direct suction of the mouth. Wow, can you imagine how clean the mouth of the traditional practitioner is no kung last week pa siya last nag-toothbrush. So are the most prevalent non-medical alternatives in provinces that deal with wounds caused by animal bites. This is from the Philippine Journal of Science. Yes, it's very true. Please do not use tandok, no? Do it the scientific way. Wash it, clean it properly. Okay? And
not
then, yeah,
the practitioner will also be at risk of developing rabies because of
doble.
ingestion. Yes,
Yeah.
so not recommended at all. Please do not do that. very, very dangerous for everybody involved. No. Um, so we have one more question before we move on to. Okay. My dog has skipped 3 years of rabies vaccine when I go to the vet to have it vaccinated. How many shots should be given, and what interval? Now, the vaccine schedule usually is recommended by the veterinarian. For puppies, it's more important in puppies and developing antibodies like Tokaibi mentioned before. But when your dog is an adult, it's usually once a year. Okay, unless your veterinarian deems that it is a high risk case, wherein he might require another vaccine after 1 month.
Yes.
But
Better
most of
safe
the
than sorry, right, Dr. Gills?
yes, better safe than sorry. It's usually one, but again, it depends. It depends on your veterinarian what the recommended uh, schedule will be, and um, please don't skip as much as possible. It's not worth the risk for your family, yourself, and your pets. No, it's something that's very easy to get. It's readily available, and the protection is very, very good for everybody involved. No.
Actually, Dr. Gills, this afternoon we'll also be giving rabies vaccines for those who can answer our questions later. And this is
Ooh,
care of MSD. Yeah.
very nice. All right. We'll still be answering questions, but we'll take a discussion with our guests. We will be, uh,
Yes.
Doc Ivy will be introducing our guest. We will
Okay.
just get him into the studio.
So for this afternoon, we're lucky to have Dr. Charles Cubio. He is our technical sales from MSD, and their vaccine, Novivac, is one of the best vaccines for rabies. Dr. Charles, are you here? Good afternoon. Yes, your
Hi,
host,
Doc
Dr.
Ivy.
Charles. How are you, Dr. Charles? Kamusta? Asa ta karon, Dr. Charles?
Nata sa Davao karon
Sa
because of
Davao. So we are
restrictions
live
sa
from
travel.
Cebu. Dr. Charles is in Davao. And yeah, we have also listeners from Cotabato, Davao, and Zamboanga City. So Dr. Charles, can you tell us more about Novivac and how safe it is to give to our pets? Because I know that there are a lot of people now who are afraid to have vaccines for themselves and for their pets. So how effective is this? How safe is it?
Well, thank you, Doc Ivy. Novivac vaccine for rabies is very safe. It has a wide range of safety and as safe, and it can be given to pregnant female dogs. So it's very safe. And as of now, there's no significant, what do you call this? Adverse reaction recorded for rabies vaccination with Novivac rabies. Yes.
Interesting, right? Why? Why is that, Dr. Charles? It's because rabies is a it's a killed
Killed
virus.
Yes, it's a
bacteria.
killed
So
virus. Correct. Yes.
So it's really not that scary, it's not
Yes.
dangerous, and it will not make your pets weak after vaccination unless if you did not tell your veterinarian that your dog is sick during the time of vaccines.
Correct.
Okay? Because sometimes we feel na, ay, nagkasakit because of the vaccines, but then without us telling, diarrhea dito siya. That's why do not be irritated if your doctor asks you vomiting ba ang dog, 'di ba? Diarrheic, weak ba? Before, it's not because we wanted to, kanagaling pahirapan kayo, but because we wanted to be sure that you are not throwing your money. Okay? Sayang,
Correct.
'di ba? Yeah, okay. Dr. Charles, another question. Why 3 years effectivity in references of your vaccine and yet it's recommended na once a year na sa Philippines?
Well, so, in fact, Novivac rabies vaccine is the effectivity of the vaccine is actually good for 3 years. But in the Philippines, due to the high incidence of rabies, our government put a law that it is the Anti-Rabies Act of 2007, the RA 9482, that we are required to vaccinate our dogs every year. Uh, yes.
That's a very good information. So that's why for our viewers and also for the international na mga kakilala, they would always ask why only once a year in the Philippines while it's 3 years.
Yes.
Yes, it's really 3 years references, but we give it once a year because all of us need to work together to make our Philippines a rabies-free country as soon as
Correct.
possible. Okay, that's for our own protection. So, Dr. Charles, I know your company has prepared several prizes for our participants, right? So, we have
Yes.
a few doses of rabies and as well as your product, Provecto, Tick and Flea Preventative. So, would you like to ask our viewers some questions and then we can give them prizes? Uh,
Oh,
okay. Would you like us to start with the first five? To
yes.
get
Go ahead.
okay, sige. So, Dr. Charles, ask one question na medyo maalala nila. And then, for the first five that will answer, we'll give you a free rabies vaccine done in our branches. So, that's either in Manila, Robisas Galleria, Cebu, or in Park Mall, Cebu City, or in Dumaguete City. Okay? So, the first five to answer. Okay. What's your question, Dr. Charles? Something that's easy to answer.
Okay,
Bonus question.
my first question is, how often do we vaccinate our dogs?
Okay, the first, okay. Our option will be letter A, is it once a year? Letter B, is it once every 2 years? Or letter C, is it once every 3 years? The
Okay.
first five to answer will get 5 shots of rabies from Animal Wellness. And this is donated or sponsored by MSD. Okay. Okay, cool. Gumagaling sila. Okay, I think we already have the first five. Thank you so much for your attention. Ang galing. Um,
Galing.
Dr. Charles, how about for your spot on? What can you say about for the spot on?
Oh,
Na Rebecca, is it new?
yes. Actually, Bravecto Spaton is a new product of MSD. So previously we have Bravecto Chewable, but now we have the Spot On for dogs and cats. So basically, this is for also for ticks and fleas for
Mm.
dogs. So in this is prevention for infestation and of ticks and fleas that is good for 3 months. One Spot On, the protection will be good for 3 months.
Wow. 'Di ba? Kahit hindi siya related sa rabies, nagbigay pa rin ang MSD. So that's amazing. Yes. So, do you have a question for our viewer?
Yes, again,
Okay.
for the first five to answer
First five.
correctly,
Is this also for Bravecto or for rabies na vaccines?
for vaccines.
Okay, five,
So,
another five vaccines that will
this
be
is a
given
very
away.
easy question.
Ang easy, ang saya-saya naman nito, grabe. Okay.
Yes, it is answerable by true or false. Okay, so the
Oh.
question is rabies transmissible to humans from dogs? True or false?
True or false lang ang answer. First five again.
First
So
five.
let's take a look. If we have the first five, oops, baka ma-delayed ang ano nila, no? Ang internet. Okay. Oh, we have the first five. 1, 2, 3, 4, 5. Okay, we have the first five again. Thank you so much.
Okay,
Okay.
congrats.
Congratulations.
Let's,
So,
no, if you've won the first, let's give chance to others. So
ayan. Pwede,
whoever won the
para may
first
chance
five,
pa
we will pass. Yes, we will.
para lahat panalo, 'di ba,
Yeah.
Dr. Gels? Ah.
Yes. And then before we move, we have a question from our audience. Let's answer it. And once we get, please finish the second five, and then we'll answer the question.
Okay.
Okay.
So I think we have five. Yes, we do.
Yes, we do.
Okay, so we have a question from Peanut Butter. Is there a chance for over vaccination if the vaccine is still in the body? And the effectivity is up to 3 years. So, in our experience, we've been sending out titers regularly to dogs that have been that need to go out of the country, and one of the requirements is a rabies titer. And we have always found that the rabies titer has been very adequate and very safe. So, meaning to say, it does not add on every year. It is within safe numbers, but it doesn't mean there's no chance of overdosing on vaccines, especially since rabies vaccines are killed vaccines. Okay, do you have anything to add, Doc Ivy and Doc Charles?
It's better if for the first 10 years of life that they get vaccinated annually. And then after that, you may plan out the vaccinations with your veterinarian. So again, ang motto natin sa rabies is it's better safe than sorry. It's 100 preventable by vaccination, and there's no treatment for it currently. So if I choose over vaccination over not sure, I'd always choose the over vaccination. Okay. How about you, Dr. Charles?
Actually, that's correct, Doc Ive. It's better safe than never. No, as of
Mm.
now, we don't have reports for over vaccination using Novivac rabies vaccine. So it is safe to vaccinate every year.
Okay. So, amazing na meron talaga tayong tagasabi na yes or no. Okay. Okay.
Okay.
So, Dr. Gels, would you like us to continue with the Q&A? Because Dr. Charles, maybe pahirapan natin ng konti. Dr. Gils,
Okay.
maybe we can go back to your slide about that mammals that transmit rabies. This one, medyo mahirap. So, what we will do is that we will give you the broad, mali. Okay, we'll give you the Bravecto spot on as prize. Okay? Dr. Gils, can we return to that slide? Eto, the first one that can answer.
I have to bring it up.
Okay, this one. Amazing to. Oh, Aralafito. Okay, eto. Any mammal can get rabies. Amongst this, which one or which two are not mammals? Can you tell us what species can you see na hindi mammal? Two answers. Okay? Nawala?
Of course, we have to make it a little bit difficult.
Okay, so first two, and then you can get your Brevecto spot on from our nearest branch. Nearest branch to you. Okay? Brevecto spot on. Okay. So, ang galing. Si Louis Ong is the first one to get that peacock and chicken. Okay. So, we'll give you Provecto spot on and claim it sa nearest branch of Animal Wellness. Okay. So, another one. Dr. Charles, may tanong ka pa ba na gusto mong tanungin sa kanila? And Bravecto pa rin ang ibigay natin. And the
Sure.
Bravecto, Dr. Charles, it depends on their pet's weight, no? Ang bibigay natin.
Yes.
Okay, it's not specific. That's why what we will do, Dr. Charles, is that we will call them once this Bravecto spot on arrives in Animal Wellness so that they can claim it after. Okay?
Yes.
Okay, go ahead, Dr.
Okay.
Charles.
Ah. Okay. Do we need, what question? Okay. Here. This is very simple. True or false? This is only also true or false. So the price will be perfecto again. So
Oh,
the first,
swerte, ha?
yes, to answer correctly. True or false? 99% of rabies cases worldwide are because of dog bites. True or false?
Oh,
Ooh, I think animal, baka tao ang kumagat.
Baka tao, baka
Baka
bats.
tao, baka. Okay, yung first pala natin na answer, that's peacock and chicken. Okay, true. Galing. Si Virgilio got that right. Okay.
Right.
So, ang galing pag mabilis ang internet provider, no? Kasi
Yes.
pumapasok ka agad. So, so anyway, Dr. Gills, do you have more questions for Dr. Charles before we let him go?
I
So
think
the
that
answer of that one pala is true.
True.
Okay,
Yes.
that's very true. That's why, wait lang ha, before we let Dr. Charles go, that is why it is best for us to remember that if you do not know the dog and even how cute and how baby they look like, please do not offer your hand immediately or your leg because most probably they will defend their territory and bite you. And if there's no owner or if it's a stray dog, then most probably you'll be a candidate for rabies vaccine yourself. Okay. Okay, Dr. Gills.
all right. I think we're good. Thank you very much, Dr. Charles.
Thank you, Dr.
Thank
Charles,
you.
for your
Thank.
time and for please extend our thanks to MSD for sponsoring this afternoon's event. And then we will ask more questions, right, Dr. Gills?
Yes.
You still have questions?
And now, for our participants, do you have questions before we let Dr. Charles go? Baka mamaya, ang tanong niya is for their products.
Yes. If you have any other questions, there's nothing so far. Just answers to the for our prizes. Please do
Mm-hmm.
ask your questions, clarifications regarding rabies.
Yes. And yeah, again, I would like to remind you veterinarians are doctors of animals. If you get bitten, please go to your physician, the human doctor. Okay? So they are specially seen in Animal Bite Center. And then, regardless of how small your bite is, dapat wag din niyo kalimutan na it might be delikado, especially if you don't know where to find that dog, where to find the owner of that dog. Okay?
Yes,
Um,
very true. It doesn't mean that the bite is small,
mhm.
that you can't get rabies. So you have to go have a check. Even an intact hand, if you have a wound with your nail and a rabid dog bites it or licks it, you can get rabies.
Oh, there's a nice question here. What to do if there are allergic reaction to vaccination? This is a very, very nice question because there are some pets that would react to vaccination. So what we would like you, actually, most of our doctors would always say, please sit down for a while and please check if the dog reacted. Ano ba yung reacted? Sumigaw ba or ano? But no, it's not the sigaw. You look at the face, no? If your dog has bulging eyes and all of a sudden naging chinito, okay, that is a reaction. If the lip are thin and then all of a sudden it's thickened na parang Sharpay, that is a reaction. Okay, or if there's itching, severe itching of the face or swelling of the face, that's a reaction, as well as the other parts of the body. So what do we do? First is that we take note of that reaction, go to our veterinarian, call our veterinarian immediately. Okay, so that medications that can reverse those reactions can be given. Okay, or we can pwede rin bigyan ng diphenhydramine before giving the vaccine or something that your veterinarian would recommend before vaccination. Especially if you know that your pet is already reacting or have reacted to previous shots. Meron din namang ibang aso, that's a very nice question. May ibang aso naman that they're okay for the first few years of vaccination and then after a while, uy, ba't nag-react? Is it the vaccine? Most probably, it may be the vaccine, or most probably, the body is reacting differently. It's not the vaccine itself, okay? But the reaction of your pet towards that injection, okay?
Most of the time, it isn't the rabies vaccine though.
No,
It's
yeah,
5-in-1.
some other, yeah.
I've never seen a reaction of rabies alone.
Actually, me
Have you?
too.
I haven't
No,
seen it.
I haven't seen.
Most of the
Actually,
time, it's 5-in-1.
yeah, it's a 5-in-1 because it's modified live virus, okay? But just in case, tinamaan yung pet niya. Oh, this one. Which one is more safe? Chewable or spot on tick and flea preventative, right? Peanut
Oh,
butter. Yeah.
I think this is about regarding the Bravecto.
Yes, Bravecto.
well,
Go ahead, Dr. Charles.
yes. Thank you, peanut butter. Actually, both are safe for your dogs, but it depends on the behavior of your dog. Some dogs, especially very picky on eating, it is advisable to give the spot on. But if it's okay with your dog, then chewable is also good. Yes.
Okay. So both are relatively safe. I think Dr. Charles, one of the reasons why your company have this spot on is because it depends on the reaction of the pet owner.
Yes.
May ibang takot sa oral, tama ba?
Correct.
Yeah.
Some well, some pet owners also requested for spot on.
Yeah.
Don't like the chewable, but also it basically it depends on the dogs. Some dogs are relatively very picky in eating, especially small breeds. They don't like to eat anything, and sometimes they don't eat the chew. So it's very difficult na i-force mo ang dog to eat the perfecto. So there's an option for spot on.
Yeah. Others naman, they don't like the spot on because it's
Yes.
messy, it's sticky, and then from fluffy to flat hair, na, because of
Yes.
the oil. Okay.
Also, when
Correct.
they play.
Yeah.
Correct. Yes.
Ayan, we have been using spot on ever since. Kaya pala tinanong ni Peanut Butters. Thank you again for being with us, na Peanut Butters. Okay. Um, yes, Dr.
Yes, and
Gus.
all our other regular viewers,
Of
thank you very much.
course. Ang saya nga this afternoon because most of our regular viewers are watching. And then, yeah, may mga tanong pa. Okay. Dr. Charles, would you like to share any last words before we close our session this afternoon?
Yes. I would like to thank you, Doc Gales and Doc Ivy, for this opportunity. We're very honored to share, especially with MSD, collaborating with Animal Health,
Animal wellness.
AZ Animal Wellness Veterinary Hospital. Uh,
Kanya-kanya mistake.
yes. Thank you very much. And hopefully, this will not be the last. So, next session as well. So, hopefully, we could collaborate this with you.
Yeah, ang
Okay. Thank
saya. Thank
you.
you, Dr.
Thank you
Charles. Thank
so much.
you. Bye-bye.
Bye bye.
So, bye-bye. For all our viewers, ang saya because we have already tapped several of our sponsors. So every time we have these sessions, it becomes more interactive. If you have any more questions, please feel free to post. And then we would like to thank all the viewers this afternoon. Thank you for the participation. And we still have several prizes, Dr. Gills. Would you like to give a bonus question para wag naman masayang yung natin, prizes?
Yes, there's one more question. I'd also like to invite everybody to please invite people that you know so that we can share more and teach. Our goal is to educate. We
Yes.
want we want to show other people the importance of preventive medicine and help other people understand the veterinary side of things. So please
Yes. Oh, Dr.
tell
Gills.
everybody.
Yeah. I have one question pala. This one, it's important. Is there any treatment for rabies virus? True or false? We'll still give five rabies vaccines, no? To the first five that answers this question. Again, let's give chance also to those na hindi pa naka-answer about uh, or wala pang rabies vaccine na prize. Okay, true or false? Is it ano? Our answer is false, correct. So there is no treatment for rabies virus, but it is 100% preventable. Okay, you can prevent that by rabies vaccination. Okay, go ahead, Dr. Gills.
Okay. So I will be showing a picture. How many prizes do we have left?
Madami pa. So, pwede pa rin tayong first five or pwede tayong depende kung gaano kagaling ang viewers natin.
Okay. Sige. First five that can identify what this blue thing is on the screen can get avail of the free vaccine.
The blue part, is that the extension of our hair? If we're too smart?
Yes. So I will give a, well, there's several answers already. I will give a hint. It is what makes up the nervous system.
And since walang true or false dito, what we'll give is a Brevecto spot on that you can claim from our sa branches nearest you, from our branches, animal wellness branches. I listened before. Nako, oo nga, Maker Nice. Sana you listen before, pero hindi namin kunento ko na itong blue. Uh,
We have several answers that are correct.
yes, okay. So, Dr. Gills?
Yes, we have our winners already. Unfortunately, we will not allow veterinarians to.
It starts with letter.
And there are neurons.
Yeah. So, nako, sorry for the veterinarians na nag-join. So, okay, we have one non-veterinarian. Si Virgilia got that.
And peanut butter.
And peanut butter. Okay. Okay. So, it's been an interesting afternoon, and we really appreciate participation of our audience. So, Dr. Gills, would you have any parting words? Oh, yeah. We'd like to see you again in the next 2 weeks for another topic, and we have another sponsor for our topic.
Yes. Thank you very much, everyone. It's been fun as always. Uh, Please don't forget to have your pets vaccinated. It's much easier on everybody and it prevents so many diseases. Thank you very much and see you in 2 weeks. Bye
Thank
bye.
you. Bye bye.